From Fox 5 News, it's time for more Good Day New York.
Hit the music, and I want to talk about arms for a moment. There is Madonna, Material Girl. You noticed, I guess it was back in the 90s, she really started body sculpting, and those arms on her are like guns, Rosanna.
They're formidable. I mean, everybody was going, can we get the Madonna arms?
Now, she wasn't always like that. She actually had a little bit of
movements.
She was a little pudgy at times. Actually, the arms have been a focus of men and women, particularly women, for a long time.
Sometimes the working out is just not enough, although there are people who believe you can do it solely by working out.
All right, we have assembled a panel of experts and their patients who have been battling this jiggly thing for a long time.
I call that mozzarella, by the way.
You call it mozzarella?
Yeah, which, you know, it always boils down to food for me.
Well, you don't want that cottage cheese effect, right? You don't want that. All right.
Now, if you've tried exercise and it hasn't worked for you, then Dr. Paul Frank might be the answer. Hi, nice to have you.
Hey, how are you?
Dr. Paul Frank is a cosmetic dermatologist here in New York City.
Yep.
So what do you have for this?
Well, I look at this as like exercising the skin. You can't really work out the skin by going to the gym, and people complain of crepiness. So what you want to do is
the crepiness is like when, like the little
like
thing.
the cigarette paper skin, it thins out and it creates flabbiness.
Ooh.
So we have technologies now that could actually increase the functioning of collagen building and get those fibers tightened up again. And the main technology we use, this is called the Exilis Ultra. And it's actually the only device that combines two very popular forms of skin tightening: radiofrequency energy and ultrasound energy.
What's your name?
And Gluck.
Ann Gluck.
Yes.
Yeah. Now, your arms, I mean, you've got fine arms, but do they cause you stress? I mean, let's see. I mean, you got, all right, you're not ripped. I think it's safe to say. I mean,
Right.
but
No,
so
she's womanly.
you really,
right?
you don't like your arms?
No.
You don't?
No.
You want to look like Madonna?
Sure.
All right, doctor, can you help her out?
Yeah. So basically,
does it hurt?
well, you tell me.
Okay.
I mean, basically what we do is it feels like a hot stone massage, and there's a temperature gauge on there, if you could see. We heat the skin to
I
40
see.
degrees.
40 degrees.
Centigrade.
Okay. Let me see what it's at now. It's
And
at
that-
30 something.
Yeah, and it takes a few minutes. The average treatment is about 10 minutes.
And that's all you do is you kind of go up and down on that?
I mean, we have two of these machines in the office. We do the whole body. But the arms are a very popular area because you just want to smooth out the skin and help with some of the looseness that people use when they move around.
So, Doc, how many times do you have to do it?
Well, people do a package of about 5 treatments, but like exercise, you can't work out for 6 months and then never do it again. So most people come in before vacations or before the summer just to kind of boost up the collagen fibers.
Do you have any special plans for those arms?
Sure.
Like?
Going to maybe talk to Frank.
All right.
And how much does it cost, Dr. Frank?
Well, you probably spend about $2,500 to $3,000 for a package, and then it's much cheaper to do maintenance once in a blue moon.
So can you do it? Do you find that like some people at a certain age, like no matter what exercise they're going to do, they need a little bit more help?
Sure. I mean, it's always a combination of small things that give the best result, and I think certainly exercise is the first step.
Exercise, Marianne.
And then I handle the icing on the cake.
All right.
Yes,
Now,
I agree.
you're in the early stages of this process, correct?
Correct.
All right. Now, we have another patient, Dr. Paul Frank's there. Let's take a look at before and after. And wow. And this is pretty good. This is no liposuction.
This is no
just
liposuction.
that thingamajig you
Now,
got there.
is this our patient right now or somebody
No,
else?
that's somebody else after we had a whole series of treatments. It is important to know that if it's severe, people can eventually need liposuction.
That
though.
really works. You didn't Photoshop that at all,
No,
Dr. Paul
no
Frank.
face tuning, no arm tuning.
Wow, that's pretty good. That's tight.
How long did it take?
Well, that takes a few months. People are coming in for treatments every 2 to 4 weeks.
Any side effects we should know about?
No, I mean, it feels hot. There's always risk of burn, but if you're having it done by a medical professional, someone who knows what they're doing, it's very, very low risk, and you can go right back to activity.
Is it Aunt Gluck? Miss
Yes,
Gluck? Are
yes.
you excited?
Yes.
That looks actually pretty cool.
It sure does.
All right, we're going to wear all these sleeveless dresses
right.
now.